Thank you. The next item of business is a statement by Neil Gray on delivering reform and renewal for health and social care. The Cabinet Secretary will take questions at the end of his statement, and hence there should be no interventions or interruptions. And I call on Neil Gray to make his statement. Up to 10 minutes, please, Cabinet Secretary.
Thank you, Presiding Officer, for the opportunity to update Parliament on the Scottish Government's progress in advancing the health and social care reform programme following the vision that I announced to Parliament last year and what was set out in the First Minister's speech in January. Today marks an important milestone in that journey. I am pleased to announce the publication of Scotland's Population Health Framework and the Health and Social Care Service Renewal Framework, two vital components in delivering our shared vision for a healthier, fairer and more resilient Scotland. Together, these frameworks represent a significant step forward in shaping a future where people live longer, healthier and more fulfilling lives. As the First Minister outlined earlier this year, we are taking bold and ambitious action to reform our health and care systems, delivering the transformation the people of Scotland need and expect. Alongside the NHS Operational Improvement Plan published in March, which is about improving service delivery now, these frameworks will drive forward public service reform in health and care with a focus on prevention and joined-up efficient services. They provide clear direction in how we will plan and deliver services for the whole population, while tackling the deep-rooted inequalities that continue to impact health and well-being across Scotland over the next decade. And as the First Minister set out just yesterday, they are part of an essential shift to a front-foot focus on prevention. They are public service reform in action in our health and care system. The Population Health Framework, co-developed with COSLA, reflects our shared long-term commitment to improving health and well-being across Scotland through a preventative, system-wide approach that addresses the broader drivers of health. Improving health and reducing inequality remains central to this Government's ambition. Yet we must face a hard truth. People in Scotland still experience vastly different health outcomes depending on where they live and the circumstances that they face. Too many in our most deprived communities live shorter lives and spend more of these years in poor health. That cannot continue. The core purpose of the Population Health Framework is to improve life expectancy for everyone in Scotland and to reduce the unjust and avoidable gap between our most and least deprived communities. By shifting the focus from treating illness to preventing it, addressing the root causes of poor health and targeting our efforts where they are needed most, we can ensure lasting improvements for this generation and for the next. Most of what affects our health happens outside a health and care setting. It happens in homes, in nurseries, in schools, in workplaces, in parks and green spaces. It happens in each and every one of our communities. And that is why the framework contains 30 initial actions across these drivers of health: good early years, jobs, income, powerful communities. It focuses on two early priorities: hardwiring prevention into our system, how we plan and deliver and budget and account, and improving healthy weight. We know the toll living with overweight and obesity takes on the health of our people. We know it is preventable. The evidence tells us tackling the environment is key. So that is why one of the first actions of the Population Health Framework will be legislating to make the balance of foods available on promotion healthier and to restrict the location of less healthy foods in our supermarkets. That is what our clinical leaders treating our people have called for, and we will align with similar legislation in England and Wales. That is what our business leaders have called for. This is the whole system approach in action, delivering the decisive shift to prevention that the First Minister called for, following the evidence, tackling the environment, not blaming the individual, working with business, not against it, all of us across all of our sectors and interests working together. And as we move through the next decade, the framework will evolve and adapt to future challenges, meeting emerging needs and driving progress where it is needed most. Alongside the framework today, we publish 4 sector summaries on the roles the whole system plays in creating health. Developed by our business sector leaders, our community and voluntary sector leaders, our local government colleagues, as well as NHS leaders, these summaries demonstrate the role all sectors have in health and the opportunity they all have to do more to improve health. The business sector influences health through good employment with fair income, through the goods and services it produces, and through supporting thriving local economies. The NHS plays a central role in improving health, not only through the delivery of healthcare, but as an anchor institution that works in partnership with local communities to improve the building blocks of health. Local government offers a critical leadership role and collaborates through local partnerships to deliver public services that strengthen health. And the community and voluntary sector is uniquely situated to build trust, reach key population groups and support prevention through person-centred approaches, the delivery of critical services and the creation of community assets. This is the whole system approach public service reform requires, and we are grateful to our system leaders across all of the sectors for their work developing these summaries. In tandem, Presiding Officer, the Health and Social Care Service Renewal Framework sets out a clear path to ensuring a sustainable, high-performing health and social care system, one that can meet the future demands and evolving needs of our population. It will ensure long-term financial sustainability, reduce health and care inequalities, further harness the benefits of digital technology and improve health outcomes for people in Scotland. At its core are 5 principles that will shape the future of care in Scotland. First is prevention. The Population Health Framework looks to prevent illness occurring in the first place. The Service Renewal Framework builds on that with a focus on early detection and supporting those living with long-term conditions. Second is people. We will design care around individuals, not systems. People will be empowered to be more in charge of their care and more involved in the decisions about their support and treatment. Third is community. By rebalancing our resources, it will be easier for people to access services and a broader range of treatments closer to home. Fourth, population. We will plan services based on the needs of our populations, not administrative or geographical boundaries. And fifth, digital. We will embrace technology to improve people's access to modern, joined-up and efficient services. People will have the choice to access information and services digitally in an inclusive manner. This means more treatment will be delivered safely, closer to home, whether you live in a town, a rural village or an island. For example, our digital front door service will mean that you can manage your condition, coordinate your appointments and see your diagnostic results, all from your own phone. For our workforce, our efforts to capitalise on digital innovation means having the right digital access and information you need to do your best job. This will streamline support, reduce your administrative workload, freeing you up to spend more time with patients and people. We know that digital systems and smarter ways of working are not just enhancements, they are essential enablers of reform. So the ability to meet our health and social care reform objectives hinges on how effectively digital tools are deployed, making digital transformation a strategic imperative for sustainable, high-performing health and social care services. This transformation will be underpinned by strengthened governance, providing clear accountability, robust oversight and empowered leadership. Through these principles and the major changes we have set out within them, people will experience faster, fairer access to services. The workforce will have new opportunities to deliver care more effectively and efficiently and will create a system fit for the future. As the First Minister highlighted yesterday during his speech at the Queen Elizabeth University Hospital, renewing Scotland's essential public services must be rooted in a long-term vision, one that prioritises prevention and early intervention. Both the Population Health Framework and the Service Renewal Framework place prevention at their very core. To support this transformation, we are bringing together existing national resources, which are currently spread across several national boards, into a single coordinated body called NHS Delivery. As part of this change, we will merge NHS National Services Scotland and NHS Education for Scotland. This will ensure we are better equipped to deliver key priorities, including making progress on our digital ambitions. It will enable us to provide clear, streamlined support to local systems, delivering on Once for Scotland services, both for NHS Scotland and potentially the wider public sector in the period ahead. We are not proposing structural changes for the Scottish Ambulance Service and NHS 24, but we do expect them to work much more closely together, supported by enhanced joint planning and coordination, building on existing collaboration. This will support transformational improvements in urgent care so that people can access timely, appropriate support wherever and whenever they need it. Presiding Officer, in closing, I want to acknowledge the vital partnership with COSLA in developing both these frameworks and also call on partners across government, across local authorities, the NHS, third sector, business and communities to continue with us in delivering this ambition. We developed these frameworks together and I want to implement them together. I spoke earlier about all of us, across all our interests, working together to improve health. That applies in here too, in this chamber. I know that everyone in this chamber wants our people to enjoy good health and our services to be modern, joined up and efficient. So together, through shared purpose and coordinated action, we can build a system that not only treats illness, but also helps people to live longer, healthier and more fulfilling lives. Thank you, Presiding Officer.
Thank you, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow around 20 minutes for questions, after which we will move on to the next item of business. It would be helpful if those members who would wish to ask a question were to press the request to speak buttons, and I call Brian Whittle.
Thank you, Deputy Presiding Officer. Can I thank the Cabinet Secretary for early sight of his statement? But having read this statement, my overriding feeling is, what a breakthrough. Who would have thought that investing in preventative health and digital solutions would benefit the NHS and the health of our nation? Rarely have so many statements of the blindingly obvious been contained in a single Scottish Government publication. Going back to my first debate on the 7th of June in 2016, I championed preventative spend and investment in digital solutions. The then Cabinet Secretary for Health, Shona Robertson, said, and I quote, "I am committed to taking forward our health and social care agenda in the context of public sector improvement against the 4 pillars of public sector reform in a response to the Christie report, that being prevention, integration at local level, workforce development and focus on performance with outcomes-based targets." End of quote. Scotland's poor health record and low healthy life expectancy is no secret. In fact, the solutions have been in front of us for decades. So can I ask the Cabinet Secretary, how will you quantify preventable spend and how will you measure success? Considering this document has apparently taken years to come together, when do you expect the changes within this document to actually be achieved? And finally, the much-trumpeted digital front door, commonly known as the NHS app, and first announced in 2021, is expected to be providing limited services to dermatology patients in Lanarkshire by the end of the year. When does the Cabinet Secretary expect it to be able to do for patients in Scotland what it can already do for all of the patients in the rest of the United Kingdom?
Cabinet Secretary.
Brian Whittle for what I think was a support for what we've set out in these documents. I recognise that there has to be a continued emphasis upon prevention. I think, given what Ms Robertson previously set out in my role, we have seen significant steps taken forward to move to a more preventative model, including some of the work that's done on urgent care pathways and what has been done with example in a hospital at home. But this is an acknowledgement that we need to do more. We need to go further and we need to go faster. Also, when this will be delivered by, we have set out that both of these documents are to make progress over the coming years, but I expect to see elements delivered quickly. There are areas such as what I've announced around high-fat, salty, sugary foods, and indeed the structural changes that we're proposing around some of our national boards to be happening now. And in terms of his question around the digital front door, he is correct. The initial pilot is happening in Lanarkshire at the end of this year, and we expect it to roll out further into 2026 for the rest of Scotland.
I call Jackie Bailey.
Presiding Officer, this is simply tinkering around the edges. The SNP plan would simply merge 2 special boards rather than implement effective reform. It's gesture politics that will not actually create an NHS where systems work together and money follows the patient. Now, whatever the new board is called, the hallmark of this government is the lack of delivery. If Neil Gray wants me to come up with ideas for him, then tell John Swinney to call the election now and I will do the job for him. And I am not holding my breath about the promise of an NHS app. Used by NHS England since 2018, developed by a Glasgow-headquartered company, but ignored by the SNP. Instead, we have a pilot in NHS Lanarkshire alone. So a manifesto commitment to have an all-Scotland app, broken but cynically re-announced. The Cabinet Secretary rightly talks about prevention. But for the past 18 years, this SNP government have funded crisis, not prevention, with Audit Scotland identifying cuts of £560 million in social care.
Please put your question. You're over your time.
Of course, in this year alone, services are being cut to the bone. Presiding Officer, today's statement amounts to little more than gaslighting the people of Scotland with announcements that will never deliver from a government. I'm trying to. From a government that is running out of ideas and is fast running out of time.
I don't know if there was a question there, Cabinet Secretary. Please respond.
I'm not convinced there was a question there, Presiding Officer. I'm genuinely looking to engage with colleagues across Parliament on the contents of what we have put to Parliament. The Service Renewal Framework and the Population Health Framework are about generational shifts in the way that we deliver our health and social care services, shifting to a more preventative model, shifting the balance of care to see more services delivered within our communities and ensuring that we intervene earlier in ensuring that we don't see an escalation in an individual's poor health. In terms of the digital front door, it is going to go further than the NHS app available elsewhere in Scotland, because it is going to be an integrated health and social care digital front door to make sure that there is that coordination that we need to see, that Jackie Bailey asked for but isn't being delivered elsewhere in the UK. And I'm more than happy to work with her and with others across the Chamber to make sure that the vision that is set out for health and social care services in these documents is delivered.
Could I remind those members who are seeking to ask a question to please check that they have pressed the request to speak button. I call Emma Roddick to be followed by Annie Wells.
Thank you, Presiding Officer. I've heard from constituents who are BSL users who have been assessed for a care support package but cannot access the support due to a lack of BSL-trained support workers. I know they're very keen on the inquiry being held by a Qualities Committee right now, and I wonder if the Cabinet Secretary can provide any reassurance to those who use BSL that health services are aware of any gaps in provision and focused on closing those gaps.
Cabinet Secretary.
Thank you. I thank Emma Roddick for her question. A shared aim of the Population Health Framework and the Service Renewal Framework is to reduce health inequalities by ensuring that services are designed and delivered in ways that are inclusive, equitable and responsive to the needs of all communities. The Government's BSL National Plan that was published in 2023 represents our ongoing commitment to making Scotland the best place in the world for BSL users to live. Ensuring equal access, opportunity, representation and inclusion are key components of our plan, stemming from across areas such as education, health, justice and culture. And through the National Plan's Implementation Advisory Group, we will be working with key partners who represent the deaf-blind communities to ensure we are held accountable for the actions in the plan and draw on their experience to strengthen delivery, including on the areas that Emma Roddick has asked for.
I call Annie Wells, who's joining us remotely, to be followed by Audrey Nicholl. Ms Wells.
Thank you, Presiding Officer. Cabinet Secretary, the Government says it wants to prioritise community-based preventative care, but right now Glasgow's Huntington's disease specialist service is facing closure. These are frontline professionals preventing hospital admissions and supporting families in crisis. So can the Cabinet Secretary act to protect these essential services before more vulnerable families are left behind?
Cabinet Secretary.
Thank you. And I recognise the question that Annie Wells has posed and the seriousness with which that will be felt by the community in Glasgow that receive Huntington's support. We are working in collaboration with these two documents with the Convention of Scottish Local Authorities, recognising that they are in many ways our delivery agents, along with our health and social care partnerships. We have invested an increased level of support to our local authority partners, which should also see an increased level of support to our health and social care partnerships. But I recognise that at the moment difficult decisions are still needing to be made. What these two documents do is set out the framework and the footprint for how we can shift the balance of care and shift the balance of resource, where resource goes to support those more interventionist, early intervention priorities, such as that Annie Wells sets out. And if she wants to write me with the details, I'm more than happy to see what can be done in the short term.
I call Audrey Nicholl to be followed by Carol Mockin.
Thank you, Presiding Officer. The landscape of general practice in Scotland has changed significantly in recent years, with rising numbers of people living longer and with more than one condition. Can the Cabinet Secretary outline what reform opportunities are being considered to enable GPs to offer a greater specialist response, meeting the needs of population groups across areas such as cardiac and frailty?
Cabinet Secretary.
Audrey Nicholl is absolutely right that general practice is going to play an ever more important role in the delivery of our services going forward, and for us to shift the balance of care for our constituents to receive services within the communities that they call home will require us to ensure that we continue to support general practice to be able to do that in a sustainable way. A further £10.5 million is invested in this year to expand targeted interventions by GP practices for cardiovascular disease and frailty prevention. As part of this investment, we have already agreed an enhanced service with the BMA that will increase the number of proactive interventions to prevent cardiovascular disease having a significant impact on patients' long-term health outlook. And by spring of next year, we will offer a frailty-enhanced service to general practices, enabling each GP practice to identify a frailty lead, and this lead will help drive improvements in frailty care through training, data optimisation and cross-sector collaboration.
I call Cara Mochan to be followed by Emma Harper.
Thank you, Presiding Officer. I welcome the publication of the long overdue Population Health Framework and the Government's response to the high in fat, sugar and salt consultation, which has just been published in the last few minutes, although we were promised it at the start of this year. These are critical in improving health and reducing inequalities. However, I fear that the Government's actions fall short of its ambition. Can I ask the Government when it intends to publish its impact assessment on high fat, sugar and salt? Because if the Government is truly committed to delivering improvements to health and reducing inequalities, then it will need to ensure these regulations are brought forward, or otherwise it's just the usual piecemeal approach to public health intervention.
Cabinet Secretary.
A number of things to say. First of all, I appreciate Carol Mochan's welcome for the papers. I think her and I have a lot of shared endeavour in terms of what they can achieve, and recognise the importance that they can play in supporting and enhancing health and social care services. On high fat and salty sugary foods, we'll be setting out our regulations later this year, and I would expect the publications that she's asked for to be a part of that. We are also, in terms of the ambition part that she stressed, we are in these regulations will be matching where England and Wales are already, so there is a consistency across these islands. But I recognise that there is more for us to do on ensuring that we're supporting people to have healthy, active lifestyles and to tackle obesity, and that's what the Population Health Framework is all about, trying to enable people to be able to deliver upon.
I call Emma Harper to be followed by Patrick Harpy.
Thank you, Presiding Officer. It's on a similar vein regarding high-fat sugar and salt foods. The Cabinet Secretary will be aware of the work of Henry Dimbleby, Dr Tim Spector and Dr Chris Van Tullochen regarding ultra-high processed foods and ultra-processed foods and their links to high-fat sugar and salt foods and the connection to poorer health, and my interest in this also. So can the Cabinet Secretary say a bit more about the actions that will be taken regarding the promotion of healthier foods and the restriction of less healthy foods in our supermarkets?
Cabinet Secretary.
I recognise Emma Harper's long-standing interest in this area and the work that she has done, as well as the Health Committee that she sits on has done in order to advance this work. We will be setting out the regulations later this year that will provide the fulsome detail of this, but where products can be located, how they can be promoted, and to whom is going to be at the centre of this, and aligning ourselves, as I said in answer to Carol Mochan, with the regulations that there is in place in England and Wales, to ensure that there is consistency across these aisles for those that are selling these products.
I call Patrick Harvey to be followed by Alex Cole-Hamilton.
The context in which these documents land is one in which we're seeing significant cuts to existing prevention services right around the country. Just from constituents in Glasgow, we're seeing cuts to the Glasgow Psychological Trauma Service, the Huntington's Disease Specialist Services, Adult Mental Health Services, Flourish House, the Falls Prevention Programme, the Counselling Service at the Sandyford Sexual Health Service, and breastfeeding support from NCT, and that's just Glasgow alone. Does the Cabinet Secretary acknowledge that we are already losing prevention services that have been having success as a result of the way that IGB decisions are being made? That's going to have a human and financial cost in future. And does he acknowledge that the way the IGB makes these decisions is democratically unaccountable and needs to change?
Cabinet Secretary.
In answer to Annie Wells, the fact that we have delivery agents that we need to work with in order to make sure that decisions that are taken at a local level reflect the national policy direction that are being set out within these documents. I also recognise that we need to be continuing to support local areas, as we are doing. Our local authority partners received a record funding settlement. Our health boards received a record funding settlement this year, and they are the funders of our health and social care partnerships. So I recognise that there is local decision-making to be taken, but some of the areas that Patrick Harvey has set out are not areas that I believe would be in keeping with what I'm setting out here with the population health, all the strategic, the service renewal framework, and directed towards preventative areas of spending. And that's why I'll continue to work with them, as we have done in the development of this product through COSLA, to ensure that there is a recognition for the importance of prevention.
I call Alex Cole-Hamilton to be followed by Paul McLennan.
Thank you, Presiding Officer. Presiding Officer, strategies and recovery plans like this come and go, but the health and social care sector is still on its knees. And nowhere is that crisis more acute than in our remote, rural and island communities. Yet this renewal document suggests those communities will have to wait until year 9 before they can expect care standards that meet quality standards. All the while, mums will have to drive 100 miles down the A9. Care homes in the Highlands will continue to close, and care visits will be cut short because of travel time. Does the Cabinet Secretary really expect that those communities will be happy to wait until 2034 for care that we all expect now?
Cabinet Secretary.
It's not what we are setting out. We are expecting the framework to help to inform decision-making from now. So the decision-making process that the service renewal framework and the population framework sets out is about taking these considerations into account. We will continue to work with our boards, both those that represent rural and island communities, to ensure that there is service parity available to people. But I'm born and brought up in an island community. I know what it's like to travel to receive services, and so I recognise that for some there will inevitably need to be some travel involved. What I want to do is make sure that that's done on an equitable, fair and supportive basis, so that we can see a better situation for the island communities that I'm from the communities that colleagues across this chamber represent, so that we can see a better system for the people of Scotland.
I call Paul McLennan to be followed by Finlay Carson.
Thank you, Presiding Officer. For a number of years, social care recruitment has been a challenge in the east of East Lothian, in particular the rural villages near Dunbar, Hannington and North Berwick. On building a care at home, can I ask the Cabinet Secretary what strategies it will have in place to address the issue of social care worker shortage in rural areas and villages such as Innerwick, Gifford and Gullen in my constituency?
Cabinet Secretary.
Thank you, President Officer. I thank Paul McLennan for his question. We're clearly aware of the challenges of recruiting staff in rural and island communities. Changing demographics, increased needs only adds to these challenges, and the Population Health Framework and the Service Renewal Framework set out the key areas of reform and the principles we will work to that will reduce pressures, increase opportunity, improve integration and transform how services are experienced by the workforce and those that they support. What won't help us to be able to attract and retain our workforce is the damaging policies that have been taken forward by the UK Government around our social care staff, and in that regard I would encourage them to think again.
I call Finlay Carson to be followed by Claire Hawkey.
Thank you. Forced to deliver a £30 million budget cut in NHS, Dumfries and Galloway are seeing a systematic dismantle of the local health services. Cottage hospitals are being closed, maternity services shut, no hospice provision and care home beds are critically in short supply. And yet this government claims to want to deliver on 5 principles of reform. So, Cabinet Secretary, how does the closure of maternity services and cottage hospitals align with the second principle of people, designing care around individuals and empowering them to make their care decisions? And how does it support the third principle of community, bringing services closer to home where expectant mothers are forced to travel miles for basic care? And how does it reflect the fourth principle of population, planning services based on local needs when the needs of rural families in Galloway are being ignored entirely? Isn't it the case that this government's rhetoric on reform is completely at odds with lived experience?
Has got the 3 questions. Just
Thank you, Presiding Officer. I well recognise the issues that Mr Carson takes forward. It's something that I've engaged with his constituents on when I was at the Dumfries and Galloway Board review, annual review last year, and when I met trade union colleagues in his area as well, and the meetings that I've had with him to discuss these matters. I would say that the thread that runs through all of what he has set out is safety and ensuring patient safety, and we rely upon clinicians to give us the advice on ensuring that services remain safe. I recognise that that is always a balance that needs to be struck between needing to travel and ensuring that we get safe and timely access to services. And again, as I say, I'm someone from an island community. I recognise the need to travel for services and what that means and the burden that it can have on individuals and their families. And we always want to make sure that when these decisions are taken, they're taken in a proportionate manner that reflects the needs of those communities.
I was advised that I have 3 more members who have pressed to ask a question. I will take all 3, but I do need 1 question from each, a brief question and a brief answer. I call Claire Haughey to be followed by Douglas Ross.
Thank you, Presiding Officer, and I remind members of my register of interest I hold a bank nurse contract with NHS Greater Glasgow and Clyde. As the Cabinet Secretary outlined in his statement, we know that taking preventative action at any point of a person's health or care needs can make a significant difference. Can the Cabinet Secretary advise how Scottish Government investment is helping to expand targeted interventions across Scotland, particularly for cardiovascular disease and frailty prevention, and how the Population Health Framework will complement these initiatives?
Cabinet Secretary.
Yes, I appreciate the question from Claire Haughey. We've launched the Cardiovascular Disease Risk Factors Programme to improve CVD outcomes with an aim to reduce avoidable CVD death by 20% in 20 years. We've established a new GP enhanced service from 25-26 to support 100,000 patients who are at risk of developing CVD. We will also be bringing forward funding for a frailty enhanced service. We are investing £4.5 million over 3 years to tackling type 2 diabetes, and the Population Health Framework is a cross-government, whole-society approach to creating health, using the totality of public expenditure and hardwiring prevention into our systems through planning, delivery, budgets and accountability to reduce the demand that these issues can cause in our system.
Briefly, Douglas Ross.
Thank you, Presiding Officer. The Cabinet Secretary has spoken about preventative spend. Does he agree that GPs can play a crucial role here? And I recently met with Dr Robert Lockhart from Elgin, who I think the Cabinet Secretary met on Friday, and he discussed what they can do locally and nationally with more funding. So can the Cabinet Secretary tell us what percentage of the health budget is currently spent on general practice and what percentage he believes it should be to allow our GPs to deliver more?
Cabinet Secretary.
Indeed, meet Dr Lockhart on Friday. Very pleased to do so, and we had a very informative discussion, including with the Community Council that Mr Lockhead was a part of as well. And the discussions on those areas, the latter part of Douglas Ross's question, are matters of discussion and negotiation currently with the BMA around how we can continue to support general practice, their sustainability, and how we can see them deliver more within our communities, as I know Dr Lockhart wants to see and I want to see.
And briefly, Alexandra Stewart.
In the statement, you talk about local government supporting health inequalities. Accessing information is critical. Having effective digital tools is vital. Partnership working and frameworks must be the goal, but how can they be achieved, Cabinet Secretary, without major reforms taking place?
Cabinet Secretary.
If he's asking me about a reform within local government, that's not for today, but we are seeing from the support that the Convention of Scottish Local Authorities, having provided the collaborative support for these 2 documents coming forward, is a willingness of them to engage and to recognise the role that they play as delivery agents for us in terms of our national policy ambitions. But this is a shared endeavour of ambition that we are wanting to see a step change, a generational shift in the way that we deliver services, shifting the balance of care, and I'm confident that COSLA will continue to support us in that endeavour.